You may have seen some headlines that say Ozempic could decrease your chance for cancer. Also, we're looking at how creatine can help certain women, the possibility of that, and a drug recall. A list of these health headlines here to dive into all of it. We've got our chief medical correspondent, Dr. Corr Hebert. Good morning.
Hey, good morning. We have good news today.
Okay.
It's good news, yes.
You with good news, I like that.
Exactly, right? So we have, everybody loves Ozempic, right? And all these GLP-1 drugs out there. But we have a study now that's very interesting because we looked at about 80,000 people, and it was published in JAMA Oncology. And what we looked at is, did you lose weight if you took the GLP-1 drugs? But if you did, how did that relate to your cancer risk? Okay, so we looked at a couple of cancers: endometrial cancer, meningiomas, which are a type of brain cancer, and also some ovarian cancers. And what we saw was that if you took GLP-1s, okay, that means that you had about a 17% decreased risk of these types of cancers. Now, that's a really important thing because everybody wants to decrease cancer, but this is the key I want you to pay attention to. It was an observational study, okay? That means that, is it correlating or is it causal? Meaning that these cancers that you have decreased risk are cancers that you get that when you are generally overweight or have a lot more adipose tissue. So is it the fact that you lost the weight that decreased the cancer risk, or is it the medicine you took that decreased the cancer risk? We don't know that right now, but I am excited about the fact that whether it's the medicine or whether you're losing weight easier, it's decreasing your risk of cancer, and that's something that's very exciting. So please lose the weight, but if you gotta lose it with the GLP-1, let's get that happening too.
Well, that's what I was gonna say. Either way, it's decreasing cancer. That's great, but it would be interesting to see what the findings of that final study come out. All right, now let's talk about creatine, because you're saying it could be good for some women. I know a lot of women hesitate to take creatine.
Yeah, okay, so this is the big one, all right, because I don't know how many people out there are going through perimenopause or in postmenopause and having this brain fog and all this other kind of stuff. Well, there is something that people take when they're working out. It's called creatine hydrochloride, right? But we just did a study, came out a couple of weeks ago, and we took 84 women and we gave them varying doses of the creatine, and the creatine went from 750 milligrams a day to 1,500 milligrams a day. And listen to what we found, right? We saw an increase in brain energy. We saw an increase in the frontal lobe activity, and that's focus and your ability to determine and make decisions, all right? We saw in the thalamus, which is brain coordination, we saw an increase in that. We saw an increase in the parietal lobe activity, which is movement and where you are spatially, all right? That means an overall increase in your brain activity, folks. It stabilized the mood and increased your energy. So if you're out there and you're married to someone, or your girlfriend, someone that has perimenopause, or just your friend, please, creatine hydrochloride is showing some really important gains right now because everybody's trying to lock in their gains, right? Yeah, this is a gain that...
I see what you did there.
Yeah, I know.
Okay,
Everybody's trying to lock in their gains. That's what they do, right? But seriously, get yourself some creatine hydrochloride, because I think this would be a very important step.
All right, we're almost out of time, so give the last one to us.
Okay, all right. So if you take a medicine called prazosin hydrochloride, then it is recalled, all right? It's going to be on our website to tell you which numbers, which NDC numbers, but it's the 1 milligram, the 2 milligram, and the 5 milligram. Those medicines are for hypertension, also for PTSD, and some prostate conditions, okay? So please, if you take that medication at any point in any time, you need to talk to your primary care doctor, because you don't want to just stop medication at this point. But the FDA did list it as a class 2 risk level, which means it could cause some problems for you. So go to our website, look at the NDC, see if you got it, but talk to your primary care to see how you're going to treat those issues without that medication.
All right, we appreciate you. WL Louisiana Chief Medical Correspondent Dr. Corr Hebert, and as he mentioned, go to our website for more of that information.